Hello and welcome back to SCAN is Here to Help podcast. We do this podcasts mainly to create awareness about issues that impact mental health and substance use and other issues, recovery, for example. And so it's important for us to inform the community about these issues. And then also to inform the community about the services that we provide. We have many different programs. Today we're going to talk about one specific program, but the idea is to help you get acquainted with the work that we do and the services that we provide in order that you, family members, can access those services at any time. So I'm glad to be here. My name is Luis Flores, and I'm the Executive Vice President of SCAN. And I'm here joined by two incredible staff members. Do you want to introduce yourself?
Yes, my name is Lupita Perez. I'm currently the program coordinator for the Frontera HIV and mental health program.
Yes, and Lupita is also a licensed professional counselor. And Viene, you want to
Yes,
tell us a
my
little bit
name
about you?
is my name is Vianney Mireles. I'm a licensed master social worker. I'm a counselor with the Frontera program, also for geared towards HIV and Hep C.
Yeah, I want to say we're going to talk about one program specifically. We call it the Frontera program. And any of you want to let us know about what the Frontera is all about?
So Frontera is about providing counseling services to the community for individuals that are at risk of contracting HIV or hepatitis C, and also providing mental health services to anybody that's struggling with any mental health symptoms.
Thank you so much. So then the idea is, I think that providing mental health treatment, and then because people that I guess that are suffering from mental health disorders, so they may be a high risk for contracting HIV and hepatitis. So that's the idea.
Yes.
All right. So do you want to add anything to the work that you do? What specifically do you do?
So I serve as a counselor right now at the program. I just want to emphasize that it's not only those at risk, although there is a correlation. It could be anybody who is currently struggling with mental health. I know sometimes that there's a stigma on any program that says that it's geared towards those at risk of contracting HIV and Hep C or that already have it. But the goal here or the mission here is prevention, is to prevent contracting, further contracting these illnesses, these diseases, and I just would like people to know, not to shy away. Any mental health illness is treatable. We can definitely serve our community in that aspect.
Sure. And you talked about very important things. One of them was stigma,
Right.
and I think we still have to work hard at destigmatizing mental health, and then also, of course, the risk for HIV and hepatitis.
Right.
So then I think that now with COVID-19 and all of this stuff, then I think that like HIV and hepatitis infection kind of taken, like people are not, I guess,
Like a backseat.
yeah, like took a backseat, right, to COVID, but it's still a really important issue. Can you tell us a little bit about how, I guess, people contract hepatitis and HIV?
Yes, well, it's mainly through sharing of needles, sexual contact, the exchange of bodily fluids. It's very important that we take measures to prevent contracting such illness and, I'm sorry, the disease. And sometimes we may not be thinking of these things, but for example, sharing toothbrushes and razors is also another way that you can contract the disease. Um, it's something that may seem harmless, the sharing of a toothbrush or sharing a razor or it's a quick shave. Nevertheless, that's something that it, you're putting yourself at risk. You're putting yourself out there. A lot of times, people tend to think, or again, continue with that stigma of oh, it's only the sharing of syringes and needles and drug users. They associate it with that. While yes, that is correct, sharing needles and syringes. However, I mean, sharing a toothbrush, something as harmless that you would possibly think, sharing a razor, well, it's a really quick shave.
Yeah.
It's things that people don't think about often. Also sex. It's also
Yeah.
an STD. It can be contracted via sex and the exchange of bodily fluids.
And I think that that is the most common way of contracting it, right? And then we used to think that maybe only the LGBTQ population was affected by it, but heterosexuals are also impacted by that. And so, yeah. So, and, wait, were you going to add something now?
No.
Okay. So somebody walks in, what are some of the first things that you do? Let's say that somebody's interested about the program.
I provide them with an overview of the program, what it's geared towards. I do emphasize that it's geared towards, for those at risk of or that already have HIV or Hep C. But also I make it a point to say not necessarily does it mean that is it only for this population. Again, we're here to serve the community. Any mental health illness or issue that they may be struggling with at the time can be addressed. It's just more promoting mental health and making sure that the community is aware that they have access to this type of service.
And I think one of the things that we can inform our viewers is that many times you may not think they're at risk, but if you suffer from a mental health disorder and you're willing to come, then part of the services that we do, correct me if I'm wrong, is to screen, see how high the risk is for you. And that's, I don't know, is there anything you want to add to that?
No, just any general mental health struggles will qualify for our program. We're here to provide support, somebody to talk to, non-biased opinions and conversations. Just reach out and get some help. I know I've been noticing a lot of trends for younger adults between 19 and early 20s that were affected by COVID. And thankfully they're reaching out. But I'm sure there's a lot more out there also that need support.
Yeah, and I'm glad that you brought up the issue, how the pandemic has impacted us. And a lot of people are still dealing with the after effect of the pandemic, So I think it is important to let you know that any type of mental health disorder, then can be treated to this program. So then, and my invitation to all of you is that you don't necessarily need to have a diagnosis. You can come in if you're struggling with a lot of worries, you're struggling with anxiety and so forth, and you reach out and see how we can, and let us do the screening and the assessment and to, let you know what are the next steps. What are the most common disorders that you guys see people coming here in terms of mental health disorders?
Anxiety and depression have been the primary ones, yes.
Yeah, I think so, right?
Yeah.
Those are the ones that are, I guess, more prevalent, anxiety and depression, particularly after the pandemic.
And
But-
we do have a psychiatrist on board, so if the client is willing and in need of medication, we do also provide psychiatric evaluations, and we can provide them the medication, even if they don't have insurance, while
Yeah.
they're getting serviced with us. So, I mean, that's something that we do discuss with the clients, that is an option. It's not necessary for them, but if they're willing, we can talk to the doctor
Sure.
and see if it's something that they need.
And I'm glad that you brought up the issue of medications. Yes, we do have that component also to have you be seen by a psychiatrist or a nurse practitioner, a psychiatric nurse practitioner, and then determine the need for the medication. Some people, going back to the stigma issue, some people think that medication is bad or only certain people take it. And that is going to be up to you and the discussion that you have, right, with the psychiatrist to determine if that's something that is recommended and something that you're willing to do and is something that really be helpful to you.
I think a misconception about mental health medication is that something that they have to take forever. And it's not always the case. Sometimes it's just needed temporarily and just to help them get stabilized so that they can get the tools and talk with their counselor about what needs to be done and work through the underlying problem. And then hopefully in time they can decrease the medication through the doctor's orders.
Yeah. Yeah, so then, yeah, because going back to the people have the wrong idea about what, psychotropic medication is to treat anxiety and depression. And then we have at least in the, last decades, we make a lot of progress in terms of medications that are effective. And so these are not medications that are going to get you addicted or anything like that, but in a conversation with a psychiatrist, then you can decide what is best for you. So can people access the medication and then also the therapy? Is that how the program works?
Yes, we have, as Lupita had stated, the psychiatrist on board. You have access to a psychiatrist, you have access to medication. We also work closely with our partners, with the Laredo Health Department, in the event that they need to be referred for further services, for like STD testing or something that we may not be able to provide here. We have good connections and colleagues in other departments and other areas that are willing and able to help us with client needs. I would also like to emphasize and put out there that we do provide free condoms. I know that going out there to go buy a pack of condoms is normally, I know, shunned upon, or they don't like to be seen or something like that. But I mean, coming into counseling, we have them readily available for you. Anybody can come in and ask for them. I know that there seems to be still a thing with using condoms. I think it's something that we should continue to push to normalize.
Exactly.
In addition to, we also provide rapid HIV and Hep C testing, and we can, in the event that a test comes back reactive, then we have our contacts and our other colleagues in other departments and other agencies ready and willing to help us with our clients, connect them to the services or treatment, if you will, if they happen to need it. So we can do that in-house. We can provide condoms. We provide testing on site, the psychiatric services, as well as follow up with the psychiatrist and medication. So I think it's we're trying to take like a holistic approach to where it's kind of a one-stop shop. They swing by, they get their mental health counseling, they're tested, they're referred to a physician, psychiatric care, and medication. I mean, we provide a lot to our clients.
Seems very comprehensive, the work that you guys do. If somebody comes in, can you tell us a little bit about screening and assessment? I know she talked about identifying needs. For example, if it is reactive, that we link them to health department and so forth. But can you talk a little bit about how comprehensive the assessment is, or how do you go about it?
We use several short assessments to distinguish what they might be struggling with. We have different screening tools. It's the PHQ-9, which is for depression. We have the PCL-5, which is screening for trauma. We have the suicide screening, and off the top of my head, I think those are the basic ones, but also I think most importantly is just talking to the client and seeing what their needs are.
Yeah,
And then we do a full evaluation after those basic screenings.
yeah. So if you identify other needs, needs other than the counseling and the referral for HIV, like if what happens, for example, if somebody says, you know, I don't have a job, or
Yes.
there are the other needs that you identify, what happens then?
So we also have a case manager as part of our team. So the counselor as well as the case manager can help with other components that have to do with case management. So if the client is struggling to find a job, they're not in a stable home, they have other medical necessities, the counselor or the case manager can link them to other services in the community. We can take time and help them apply, maybe even through the therapy, do um, some role playing as far as interview questions, if that's what they're struggling with, to give them and build them that confidence that they need to conquer what it is that they're struggling with.
Sure. So it seems like you do a really comprehensive assessment in all the different areas of the person's life.
Yes.
And then you identify what kind of linkages they need to be done in the community.
Yes.
So they can be that. So that sounds like a really cool approach, really comprehensive approach. Anything that you can speak about, either of you, to talk a little bit about the type of therapies that we use for this particular project?
We want present moment focus. We want to be mindful of the person as a whole, and help them identify what it is, the thoughts that they are struggling with that are probably holding them back from achieving some of their goals.
Yeah, and that's one of the things that is amazing about us as humans, that we have this incredible mind to can help us do amazing things, but it can also really be punishing, and in terms of giving you a lot of worries about a lot of things about the past, bringing things that are we constantly, going over and over about, and that creates a lot of suffering. So I think that we know that pretty much anxiety and depressive disorders pretty much have to do with the way that we learn how to, learn about the world, about ourselves, and so forth. So you talked about present moment. Tell us a little about what present moment means in terms of the therapy.
Well, what is happening right now at this moment. So sometimes with anxiety, we're thinking about what's going to happen tomorrow, what's going to happen in a year from now. How am I going to do it? Our mind's constantly thinking about the future, and we're missing out on what we can do right now to help that moment.
Yeah.
And
Makes sense. Go ahead.
And then with depression, we're thinking about what happened yesterday, or what happened when I was a child, or what happened last year. And so again, we want to help the client come back to the present and notice what is happening right now and where they're at right now, and what they can do right now to resolve what's going on.
Yeah. And I get really like what you said, what you can do right now. So then part of the therapy is also what are they committed to do.
Yes,
In
committed
terms of
action.
committed action about things that are important to them.
Yes.
Yes, sometimes we get caught up. I want you to be thinking about the time that you were worried and your mind is kind of problem solving again and again and again and again about things that may never happen. So what Lupita is talking about is pretty cool in terms of what is going on right now in your life. What can you see? What can you feel? What can you connect to? And then what are the options that you have, right?
Right.
And how do you act on those things that are important? So I like that present moment awareness. Anything else you want to add in terms of? I know you've been practicing the therapy, so
Yeah, I think since I began here, I started, I guess, being more aware. I am very aware. I believe I'm very aware.
Well,
I can tell you I'm aware that I'm very nervous at this
yeah,
point.
it's good. We can open ourselves to our nervousness, right, and to our anxiety. Part of the therapy, actually, is what we call acceptance and commitment therapy. It's about accepting things. Can we talk a little bit about that?
Yeah, allow yourself to feel. So I think we've through the years, right? Certain cultures, I know in the Hispanic culture, only certain emotions are accepted. Of course, happy, right? Happy is greatly
Yeah,
appreciated. Anger is acceptable, but sadness sometimes is frowned upon. And yeah, no llores, no, it's okay. Just
exactly.
toma agua.
Yeah, I know, distract the person from what they're
Yes.
feeling. Yeah.
You want a
And
dessert? It's gonna be fine.
yes, but
Food.
it's yes, but
Yeah.
we're human and we're filled with emotions and they're all okay and we need to welcome them all. It doesn't matter if it's sadness, anger, insecurity, any type of feeling that you might be feeling. It's okay. It's gonna come and it's gonna go. It's
Yeah.
just like a wave in the ocean.
Exactly, exactly. And I'm reminded of when we try not to have the feelings, right? So it creates a lot of suffering because we want to control what cannot be controlled.
Mm-hmm.
Yeah.
Yes. So an example that I use with my clients is the emotions are like the waves, right? So if you stand against the wave, what's gonna happen? Because sometimes you're like, no, I'm gonna conquer this wave, and I
Yeah.
can do it, and then it
Then
hits
you
you
get,
even harder,
yeah,
and there you go. But if you just allow the wave to take you, it's a lot smoother and it's a lot nicer. And so that's the way we should be with emotions. They're just gonna come and allow them to be there, sit with them, notice them, and then allow them to go as they go.
and I guess acceptance also means situations, right?
Yes.
I think that we get caught up so much in wanting to change things, a person or something, and then we spend a lot of energy, and we just cannot do that.
Yeah, I think often it happens that people don't realize it or want to come to terms with the fact that you can't change something that already happened, hence living in the past. And and I guess a focus of this approach is trying to bring somebody back to the present and realizing while that did happen, whatever it is that occurred in the past, that doesn't define them. That isn't what they are right now. They aren't that past or that emotion or that feeling, and bringing them back to the here and the now. What can we do right here, right now, to make things better? I mean, and it's hard even for somebody who is providing this approach and providing treatment, like to think of what could I have done better,
Yeah.
But it's the past. I mean, what can we do now? So I think it's only human to feel that the want and the need. What could I have done better?
Yes.
But bringing yourself to awareness that it's something you need to bring yourself to. What can you do now? Not
Yeah.
not what could you have done
Exactly.
yesterday.
So the mind can be really helpful in the sense that we can review things and say, how can I do things differently in the past? But if you get caught up into you want to change something that happened in the past, was you're gonna have a lot of energy wasted there
And get
with
stuck.
regret and things like that that you carry with you. So that can be just a lot of suffering, and that's what I think that is the difference between when we feel sadness and we accept it. It may be painful, but what really creates the suffering is when we don't want to feel anything or we want to avoid feeling a certain way. And that's what we call that is the intense suffering. So it's just a really interesting conversation. And I'm going to go back to something that you said because you mentioned that, or it was you, I don't remember, that there was some underlying stuff sometimes. When people come here, they think about is my sadness or substance use, but there may be something there. And you mentioned that you do a screening for trauma. Can you talk a little bit about traumatic stress and how this can impact their mental health?
There's different experiences that people may have encountered that they felt threatened at that moment. And some experiences can lead all the way to childhood. And it's something that maybe they try to forget or they just kind of put it in the back burner. But as a result, that experience is causing a lot of reaction and how they act and how they're handling their current life.
Yeah.
So we do try to help them identify any stressful events that they have endured in their life and then try to see out of all those that they may have experienced which one is the one that stands out to them. And then if there is any thoughts about that experience or any feelings when they talk about that experience.
And I think I heard that you guys do CPT, right?
Yes, the cognitive processing therapy.
Cognitive process for people that are specifically are dealing with traumatic memories about the past. And one of the things that I want to tell you, and I know you guys want to add to what I'm going to say, is that trauma or traumatic stress is treatable. But if we don't address it, our tendency is to not to want to think about bad things that happen. And then we bury that, and then we do maybe drink a little bit too much to forget it, or use coke or whatever it may be, or it can be sex or whatever it is, not to feel that. But one of the things that we know about trauma is that when you are able to talk about trauma, to really feel the feelings that you have neglected for a long time, then you may be able to see things a different way. And so trauma is definitely treatable. And I think a lot of times it is connected with depression and with anxiety. So at least that's in my experience. So you do acceptance and commitment therapy, you do cognitive processing therapy. I think that, I don't know if you guys use also seeking safety, is that part of it or not?
Yes, we have
Okay.
the seeking safety manual.
So for those, since we talk about seeking safety, which is, let me just tell our viewers what seeking safety is. This is another type of therapy that it is to help people that have experienced trauma, but also are dealing with substance use disorders. So can people that come here, is this only a program for mental health, or they have substance use disorders, can they come as well?
No, substance use disorders can come as well because it's usually correlated to some type of mental health. But definitely after we do a full screening and assessment, then we can know where to guide the client or how we will guide the therapy.
And I'd like to add that SCAN does have other resources. So there is the men's recovery shelter and the women's recovery shelter. So anybody who comes in, not only do we have our colleagues at the health department and other programs that can provide access to treatment or other further testing, but we also have access to those facilities should somebody actually have the need to go into recovery, to a recovery home, which is an intensive therapeutic approach. So I believe that having those connections and having access to all of this will provide the client with the best avenue for treatment, whichever it may be.
Yeah, and I'm glad that you talked about that, Vianney, because this is a program, right? But SCAN has a lot of different programs. So if there are many other programs that we think that can benefit you, we can link you in-house. Mm-hmm. So I think the first thing is that if you're struggling with a mental health disorder, let me just say in simple terms, if you're struggling with a lot of worries, with a lot of anxiety, you experience fear, you don't know what's going on, or you find yourself really feeling really sad and really criticizing yourself a lot, going back, reviewing memories again and again and again, it is hard for you to get up in the morning, a lot of the symptoms, reach out and see how we can help. That's our desire for you. What people have to do? Is there any cost involved? What's going on here?
Our services are completely free. They can call Our office here at Hendrix, it's 956-568-7100, and simply request to speak to someone in the Frontera program. Then anyone in the Frontera program or in any other program can screen them and see what what would be the best fit for them,
Okay.
depending on what they share with us. I mean, it's really just, we ask that you have a genuine conversation with us about what the struggles are so that we know how we can best help you. And of course, if it's something that's out of our reach, then we'll let you know and we'll guide you to the correct
Yeah.
agency.
Yes, and that's one of the things that if you don't meet the criteria for the program, we'll definitely listen to you, what's going on with you, and link you to the services that you need, either in-house or in the community. As Vianney was saying, we do have residential programs. We have a sexual assault program. We have services for children also that experience trauma. We have a lot of different programs. Come, and reach out, and we'll see how we can be of best help to you. Is there anything that I'm missing? I know that there's a lot of really rich discussion, and I have a lot of different things that I want to talk about, but some of them escape me. Is there anything that you would like to add?
I do want to add that you don't have to be a client to get HIV or Hep C testing. Tuesdays and Thursdays between 4 to 6, we do have any walk-in. We have time for walk-ins. Anyone that wants to come in and get tested, they can do so. It's completely free. It's confidential. It'll take you about 15 minutes, probably 20 minutes max, and you'll walk out of here with your results. And if you want to be part of our services, we can arrange that. And if you don't, you can continue. We'll link you to any resources that you may need.
As Lupita said, we do rapid HIV testing. So if you want to be tested, but you don't want the mental health component, that's fine. Just come in those times that she mentioned, so you can get tested. And also hepatitis C? Okay.
Yes, HIV and hepatitis C. And if you just want to come in and pick up some condoms, you can definitely go ahead and do that.
Yeah, and get familiar with where we are. We've been here a few years now. This is not our main site. We have an office, a big building, and right in front of the old Mercy Hospital. And you can see the big scan letters. It's a white building, if you're not familiar with our new location. And this is where the Frontera program is located. And what is the address here?
1702 Hendrix.
1702 Hendrix.
Yes, we're on the corner of Hendrix and Galveston.
Yeah. So services are completely free. Reach out. I guess I'm finding myself repeating that because we know how prevalent mental health disorders are and how difficult it is for people to really make the decision to call. But we are provide a really safe environment for you physically and emotionally. And we really want to understand what is happening to you. So you want to take the time to feel listened to with professionals that are, very highly qualified. We have two right here. We have others and part of our staff. So please reach out. And that's it for me. Our producer, director is telling us that that's it. So thank you so much again for being with us. I don't know, you want to say goodbye?
Thank you.
Just goodbye.
Thank you. Goodbye.
Bye.